Welcome to a new episode of Master Your Mistakes. Today we have Giovanni Santoro. Gio is a master surgeon and fellow of Bariatrics and Metabolic Surgery at University College London Hospital. Today, he's going to talk about how he made it to this point in his career and the mistakes that he made along the way to share with you guys. Gio, welcome to the show.
Thank you so much. Thanks, Jesse, for having me.
Gio, can you tell us what is the big mistake or series of mistakes that you made to get you to the point that you're at now in your career?
Yeah, I had to do a bit of reflection going sort of coming to this podcast and looking back. You know, the title of the podcast is Mastering Your Own Mistakes, isn't it? And looking back at my journey, you have to realize you're actually gone through of mistakes in your personal life and career to actually build a successful story. So it takes time, and it's more how you learn from those mistakes, how you adapt, how you reflect, and you then adjust and change things and progress out of those mistakes. And that's what I'm here. I want to share some of those moments and some of those sort of career-changing, life-changing moments along the way.
Excellent. Okay. And for viewers, could you kind of set the scene in terms of what are the details of your career? What do you do day to day, and what is your title and area of expertise?
Yeah, I give a bit of sort of background. I came to London when I was 25, so quite a while ago. I came with like medical degree. I had sort of high expectation. I was trained. I know what I want to achieve. However, I realized I had loads of blind spots. I wasn't ready fully for the system and to face loads of different cultural challenging, training challenge, and system overall completely different from the Italian system. In Italy, we are Italian. We do things with just like communication, chatting, and it's like most of our exams, assessment, was like lectures during the day, and then we used to have exams every couple of months, and all those exams were like case discussions, really oral exams, where you ask a couple of questions. You may be lucky you ask the right question, you may be unlucky ask a question a bit more difficult, and then you get a vote by your professor that is sort of subjective more than objective at time. While you come to a completely different system, you have to face being in UK, where it's very practical. When you start of your first sort of job, your expectation is you are competent in documenting, assessing patients, identifying unwell patients, and sort of making adjustment, implementing plans, and escalating this. So it's loads of mix of like practical technical skills that you have to sort of adapt straight away, coming from a completely different world and completely different system that it is. That was when I first sort of challenge really that I face, and I thought, you feel a bit, maybe, I don't belong here, things are so different, you struggle, so you lose self-doubt and sort of friction they may build with other people around you because you don't feel as supported by your colleagues. They see you a bit as an outsider, you come from a different system where they all probably gone all together in medical schools and grew up together, they all know each other, while, you come, it's a bit different to fit in at the start. And I think the other issues was really language, because you sort of learn English in Italy, but the level of English you learn in school is very, very, very basic. And you finish high school, most people can't really speak English, can't really read English, definitely can't write it. And so then you go to uni, it's all in Italian, like all your academic education is Italian, all the books you read are in Italian, lots of Latin influence in the language and so on. But it's all in Italian, you really have very little to deal with English, unless from personal sort of growth, traveling, reading books, watching movies and so on, that you do, but you don't do that much in Italy because everything gets translated. All the movie get translated. We change the title of all the movie, So it's like you have to sort of then face the language issue when you come here. So, telephone call, trying to find a job, applications, registration with medical council, sitting at English exams. I remember people calling me about potential job interview. I was really struggling to understand. I was like, okay, send me an email, see what it is. So that was definitely something, if you go to another country, learning well, having the language before, coming there makes a big difference. Speaking the language, be comfortable with the language. You already take sort of one step, one issue to face away, so that definitely make your life easier. And it's something, maybe I just jump into it. I just want to go away. I finish my training in Italy, my uni training, and then I want to change. So I just came to London to try to find a job, but without thinking all those, little things that are not that little, in insight. They're actually big challenge you face, living in different country. Sicily is very different. I grew up by the sea. It's warm all year round. It's 20 degrees in December, You have sun all year round. The food is Italian food. The culture is different. You live outside. You drive to places, your motorbike, your scooter, your car. You never use public transport. So then obviously coming into London, sharing a room with someone else, using public transport, lack of sun, being away, traffic, smog. It's all big impact on your day-to-day life, and you have to adapt to those things as well. And it can be stressful. And there is loads of people that come here for any sort of job and sector, isn't it? They stay in London for 6 months and they were like, no, this is not for me. I can't cope with this, isn't it? And they have to move.
Mm-hmm. Did you find, thinking about your almost community at that time, did you feel that your support network were close friends who weren't in medicine, or friends that were in medicine, or friends in medicine that were Italian? Or was it a little bit of a mix?
Yeah, it's difficult because I think coming here sort of alone, you don't really have the support system. You don't know anyone. So I knew a couple of people in London, but I didn't really have close friends. All my friends were still in Italy probably at the time, and then some of them start coming to UK, they start going to north of Italy, some people go to US and so on. But you don't really have the close group that you sort of relay, and you can, you got that backup and so on. So it's all just talking to people on the phone, talking to your friends on the phone, sort of, and it's also difficult to explain how things are going. So there is that also lack of, close group support of friends. And I built, loads of friendship in, more than 10 years I've been in UK. But it takes time. Life is busy, and you see people at work for a couple of hours, and you don't really, build friendship straight away. You start building with some, bonding with some people and say, okay, we get along, let's go out, let's have a few drinks after work and just talk about other things. And so you get that is important, but it takes time. I don't think I made any friends for the first 6 months I was in London. So yeah.
Makes sense. And thinking about something from a very practical perspective, bariatrics and metabolic surgery, what is that? Could you give us an example of what sort of cases you would be dealing with, and what sort of areas of the body you're operating on?
Yeah. So
and feel free to go into the gruesome details.
Okay. Well, I'll try to explain in sort of layman terms, first of all, to make it a bit more easy. So, what I do at the moment, most of the operating is on very large people that have what we call high BMI, high body mass index, and these come with sorts of lots of other medical problems. And you'll develop cardiovascular issues, you have intracranial hypertension, you'll get hypertension itself, you get diabetes, sleep apnea. So it's what we call a metabolic syndrome, because you get, with the obesity itself, you get also other medical problem. And yes, you're going to look better because you're going to lose loads of weight, okay, overall. But the reason why people have surgery as well is because life expectancy, because if you are severely obese, your life expectancy is going to short significantly. Your diabetes is going to just exponentially get worse, and all those comorbidities tend to regress after you have an operation. Now, in the sort of technical or more details of what involves, it's largely keyhole or robotic surgery. Where we
keyhole or robotic
that is a form of what we call minimal invasive surgery. So essentially you access the abdomen with trocars, so small incision around 10 millimeter each, trocar inside the abdomen, blow up the abdomen with the carbon dioxide, and then you can do largely two operations, we'll say. Then there is loads of type of it. But the two most common operations you do is sleeve gastrectomy and a bypass. So sleeve is where you operate on the stomach, and you will sleeve the stomach, take probably, I say, at least 2/3 of the stomach out. Okay, so you reduce the amount of volume.
Mm-hmm. And when you say take the stomach out, is that like all the fat, basically?
No, it's your stomach itself. So your stomach, it's what, 1.5 liters could contain. It could stretch up to like 4 liters, 4.5 when it's full of liquid or food. We make it like a 5 centimeter tube of like after 100 millimeters it can contain if you do a bypass. If you do a sleeve, it's a bit longer, but you reduce the volume. So what happened? Well, historically, we thought that you reduce the volume so you can eat less, you feel full, and so on. Now we all know with the advent of, Ozempic and Manjaro and so on, that all the surgery does the same thing that those medications partially do as well. So fire up all those GLP-1 hormones, so it reduce your appetite, make you feel nausea, make you feel full all the time, and also increase your metabolic rate, you lose more weight. So
an interesting question there. So Ozempic, obviously massive issue or big topic right now.
Yeah.
Has that resulted in fewer numbers of these sorts of surgeries? And what do you think what are your predictions for this space?
It's a bit of a stormy moment, let's say, because this is the first big change that it happens in weight loss medication ever. It's like the advent of AI, sort of equivalent in a medical world, isn't it? And those medications have become so easily accessible. Let's say easy accessible. It's still like £300 a month if you don't qualify in the NHS criteria are very strict. And yes, it obviously changes the game changer, isn't it? It's, we say surgery is not sex anymore, isn't it? Because if you can choose, I'm going to be cut open and take my stomach out, or I'm going to take a tablet once a week or an injection once a week, what do you rather do? But they come with side effect, they come with limited weight loss profile, they come with weight regain when you stop it. And also like you're going to have those side effects every time you take it. While you have your operation, you go through your post-operative care, and then it's just recovering, losing weight, optimizing everything. It's more sort of progressive journey rather than take the medication and then having to deal with those sort of nausea and side effects every day. So it's difficult, yes. It's been a change in volume, and I think we operate on more complex people. We'll operate on more complex people, someone that weighs 220 kilograms, because you can lose maybe 15% of your body weight with medication, but then you're still going to be like 150 kilograms, 160 kilograms, to achieve
220 kilograms.
Yeah.
That's a lot.
Yeah.
You and I probably weigh somewhere between like 70 and 90. That's
75, something like that.
Yeah. Wow.
Yeah. So it's challenging. It will change the game, but you will see a shift in more complex operating on bigger people as well. And it will be also like a joint. It's like chemotherapy, isn't it? Chemotherapy, it doesn't change oncology surgery, but helps and makes a difference in outcome. And you can sort of have it before, after, and I think it will become the same with medication. You will have it before having your operation. And loads of patients we operate now already been on medications. And then some people regain weight. You could operate again and change the operation at times, but you can also say, well, try the medication and see what happens. So I think it will work together.
Makes sense.
It's a big topic.
What sort of contact do you have as a surgeon with patients? Is it the sort of thing where they kind of, they turn up unconscious and you just operate? Or are you there pre and post surgery? How does it work?
Yeah, UK system is very built on, you change job every 4 months when you start. So I remember, I faced difficulty at the start and mistakes and language and so on. You also have to face different job interview to try to get your job. And then you get your first job. My first job was in Guy's in St. Thomas Hospital. So I was very lucky to work in a very nice environment. But then you work in like ED, for example, INE. So very fast pace. You have very little time to adapt. You deal with emergency situation. You see patient may come unconscious. They may have a heart attack, a stroke, like an acute bleed, and you sort of have to deal with all those things. Also, like you work night shift, day shift, at time within the same week, so your routine goes completely off the rails. It's a big impact on your mental health. So that's one of the things, reflecting, you probably need to give yourself more time, be more patient, having like not a think, oh, I need to adapt straight away. You know, it will take time. So you just have to say, okay, trust the process, stick with it, and learn from those things, and just give yourself more time and space to adapt, because it's changing job every 4 months, changing specialty every 4 months when you start is challenging, learning new skills in a different language, and it's difficult. And then, yeah, so it varies. You start from junior emergency department, assessing emergency situation and so on. Then you become a bit more senior, where your focus is a bit more into outpatients. So right now I do 3 operating sessions a week, where I see patients in the morning, go through the procedure again. We already see them before, go through the consent process. Then we do surgery. We see them post-op. And then the other days is either meeting, like we call MDT, like a multidisciplinary team meeting, where we discuss next operating for like a couple of months, and we all have a chat, we discuss complexities and so on. So preparing those meetings. And then loads of outpatient clinics as well, with like face-to-face discussions. Plus I do some endoscopy sessions, like gastroscopies and so on, as another thing every couple of weeks. So it varies quite a lot. It's flexible, and you go a bit to different, mix of sitting in front of a patient and chatting for like 15, 20 minutes, and get the patient already asleep and operating. So yeah, bit of a change.
Interesting. And you individually as a person, what part of your job do you enjoy most? Either you find really interesting, or find very, very satisfying or fulfilling? And which part do you not enjoy?
Yeah, good question. So what I enjoy the operating, because at the end is why I'm a surgeon. You do because you enjoy the technical aspect, you enjoy to do the surgery, and at the end you enjoy making a difference, because I've done different type of surgery, and like, again, you learn what you want to do, what you don't want to do. And I done a like upper GI cancer surgery, for example, where it takes a lot of toll on you. Life sort of like expectancy with those diagnoses is relatively low. There is loads of complication rates and mortality as well. While what I do at the moment usually has got very good outcome. So you see patient coming back 6 months later, and they lost 20 kilograms, 25 kilograms. They feel so much better. They say, oh, this is a life-changing thing for me. So that's very rewarding. So the technical aspect, but also following up the patient you're operating on and see how they're progressing, they're doing well. What do they like? Over busy clinic, like outpatient consultation, where you're meant to have 2 people doing it, and somehow you're short of staff. You have to deal with like 15, 20 patients in a morning session. You arrive, you got 3 patients at 9 a.m. to see already. You're like, I'm already behind, I'm just starting. So you sort of have to adapt with all those things. And it can be quite frustrating at the start and stressful, but it's another thing you have to face, and you sort of overcome and adapt to those situations. Yeah.
Gotcha. Makes sense. And what is it like working with all the different types of people, different roles, different areas that are all adjacent to the role that you do?
Yeah. It's interesting. I think it's very important. It's like when you start, you struggle to ask for help. That's one of the things as well, like mistakes you sort of make, because you're like, oh no, I can cope with this, it's fine. You just want to be able to do it on your own. Just read more about that topic, read more how to do things, read more about practical tasks as well that you don't learn in Italian medical school. And while probably like 6 months, a year into the first job, I realized, my best friend is going to be the pharmacist that work with me, because she knows more than me about medication prescribing, and if I'm going to make a mistake prescribing something that I make quite a few along the way, is the one is going to tell you, no, I'll tell you how to prescribe this, do that, and do that. And it's like, they usually like the best source of advice. When you are very junior, you deal with lots of prescription and very fast, sort of, you go through 4 or 5 drug chart and change things. Interacting with nowadays on the workup, with like daily message to like dietitians, for example, can you please come review this patient, can you sort it out, because they have more expert than us in details on that kind of advice. So I think you have to build a good professional relationship and sort of rely heavily on other and respect their opinion. So we tend to be arrogant at times as surgeon, you know. We know everything, we can do it all, we know all the aspects and everything we should tell to the patient, because at the end we do the operation, we know what we're changing. But I think it's important as well to sort of be humble at times and ask other people to help you, support you, and sort of recognize they are important in the whole process. So it's an important point sort of I learned along the way. Yeah.
Makes sense. And given that you had to experience a few different types of surgeries and areas before you settled on this area, is there any area of surgery that you had some experience in and realized there is no way I want to do this?
Yeah, I changed quite a lot of specialties along the way. Let's say broadly, for example, I was doing urology, and I was like, I'm not dealing with bladders and catheters all my life, you know. Orthopedics, gruesome. It's like, you know, it could be fine if you do like finding movement and so on, if you do like hand surgery and so on, but also like sometimes hip surgery, knee surgery is like hammering things down. And we have all those concepts of like orthobros that are like always like, you know, dress up in a suit when you go to work, while everyone is wearing scrubs, and they always go to the gym 4 times a week, and they always sort of have very strong sort of personalities. So it's the work
specifically in which area?
Orthopedics. I think most of the orthopedic surgeons are very like, say arrogant, but you got that sort of, you know, recognized behavior. Yeah, so it's probably something, an environment I wouldn't adapt, and I didn't like it, and I didn't want to go ahead and pursue, and I didn't like the technical aspect of surgery neither, to be honest. So, and then you do different things, you know, you do loads of emergency surgery, you do emergency, like you do trauma. I was working in a major trauma center where you dealt with few gunshots, stabbing, and, you know, you ended up doing what we call emergency thoracotomy in the department. So like you open someone's chest and do a cardiac massage and so on. So those things are not scary, but obviously like at times you get faced with like, you never done it and you're there, you have to do it. You know all the technical aspects, you know how to do it. But, you know, you do it in a sort of semi-hostile environment. You are in the emergency department, you're not on the operating theater, the patient is bleeding to death or is in cardiac arrest. So it's loads of pressure. And you go probably 15 people around you shouting different things. So it can be very chaotic. But also like, yeah, it's exciting, it's challenging, but then is it something you want to do all your life? Do you want to wake up at 3 a.m. for like trauma in the middle of the night? You know, it takes a lot out of you. And I think it's important to find like the right balance for things you enjoy, you're satisfied with your work, but also like, you know, you go the right sort of work schedule, and you can build your own life around. You don't have to be focused 100% on work and don't have time to actually enjoy life and do other things that are extremely important, I think.
Makes sense. And what sort of advice would you give to prospective medical students or people at the very early stages of their career?
I think you know, taking from the podcast, it's important like that you don't afraid to make mistakes. Just go put yourself out there. You know, you're not gonna learn don't making mistakes. You're gonna learn making mistakes and recognizing the mistake, reflecting on the mistakes, and then sort of, you know, a deep reflection, serious reflection, and then, you know, coming out with the stronger self, going back again. For example, I was it's sort of, you go through a strong, long application process. It's different step. It's a couple of national interviews you have to do, and you have to sit a couple of exams as well. One before you becoming a registrar, that is one of the sort of resident doctor, as they call it now. And one, once you finish the residency, you go into the next step, that is toward consultant. And my first time I've done that exam, that is similarly challenging because your stage of career is very different. The exit one is probably more difficult, but, you know, you are a different level of stage of your career. So the first one I thought was like, I'm just gonna pass this. It's biology, physics, chemistry. I studied this thing at uni, but then it's loads of pressure. It's so when then you have to face. I was facing these, for the first time, these exams. There's the membership of the Royal College of Surgeons. That is your entry exam. I was like, oh yeah, I'm just gonna do it. It's fine. And then I didn't realize how much actually effort and focus you have to put into this. And then you only have 4 attempts to pass it. And actually, I failed 3 times my MCQ, that is the quiz sort you have to do. And once I failed for like 1 question. And it's like frustrating. It's like obviously puts lots of pressure on you. You go loads of like self-doubt, and you're like, am I gonna go through this? Am I gonna, go over it? And the things I learned is sort of, if you do something, they're a big challenge, you just have to keep your focus, go for it, put all yourself into what you want to do. Otherwise, you're not gonna succeed. And it's really putting all yourself. And at times, I felt you have to be completely isolated and maybe feel miserable, because your only focus is being for like 6 months or a year, going to work, coming back work, revising for like 4 hours in the night up to 11 p.m. and then going to sleep and do it again every day, and the whole weekend working and revising as well when you have to. So what I learned is like second time around, I've done my fellowship with the Royal College exam, that is a final exit exam. I put all myself in there. It takes a year of your life. But both exam passed first time very comfortably, and very good final marks. So definitely something you learn, and something advice like, if you go to something, just put all yourself there. Don't do things halfway, because this is a very competitive world. You compete with very skilled people that, they have your same set of skills, so even higher, and some people have better position when they apply for jobs, so they go for interview. So you have to play your cards, and you have to give all yourself to not have regrets and succeed.
Excellent. Makes sense. And now thinking about yourself in 10, 15 years' time, what do you think your future self would advise your current self?
Well, it's just, I think we'll just advise, trust the journey. Put yourself always up there. Give always, the max you can give, and things will happen. It becomes, I say, the pressure shift, the pressure changes, and you go through a period where the pressure is getting the exam, the pressure is getting your next job, you get the interview and so on. And then I say you finish your career, you get to last 6 months of your contract, usually like 6-7 years contract as a trainee, as a resident surgeon. And then you're like, oh, what I'm going to do in 6 months? I'm going to be out of job. So, and you start getting stressed, You're like, you got the job security and so on, but then you're like, oh, what I'm going to do, what I'm going to find next. You're going to find a job as a doctor, but you may waste time, you may not find the right job, so, and at the end things worked, if you do the right things, if you put effort, if you communicate with people and you ask for what you want, and things happen. Like to get this fellowship, it was very competitive. There is loads of people applying, and probably 7-8 people get shortlisted for a job, and you get a panel of 6 people interviewing you. And probably there are like these are the 4-5 jobs in the country every year, and loads of people apply. So the competition rate is crazy high. But you look at it and you're like, am I the right person? Do I have the right skills? Do I have the right curriculum? And you look at people before you that done the same job, and you compare yourself, you're like, well, I don't know. I mean, I come through a different background. They have a look at their CVs. I was like, oh, this is better than mine, maybe. But then you just have to go there. You have to go for it. You have to ask for things, and then just, say, put yourself out there, play your cards, be confident when you go and do an interview, and show, you're there because you know what you're doing. You're not going to be perfect, but just go and, do your best, and that's all you can do. But, put all your effort in there.
Perfect. Excellent. Super strong note to end on. Gio, thank you for your time.
Thank you for having me. Thank you so much.